Welcome to my podcast. Today I'm going to talk about another common case that you can face in the clinical setting, and since it has been approved recently. So a patient might come to you asking for something to be prescribed for their pain. So after you introduce yourself as already agreed, double check the patient name, date of birth, ask how can I help you. The patient might say, I'm having chronic pain or any sort of condition, and would ask for certain strong painkiller, or might say that I read an article or I read the news about the possibility to prescribe medicinal cannabis for chronic pain. I just read an article and it says the benefit basically is very negligible and it's total waste of time. However, I'm just going to brief shortly about the whole medicine. It's either a plant itself or a naturally occurring ingredient from the plant. And the ingredient usually is THC, which is tetrahydrocannabinol, and CBD, which is cannabidol, and both of them called cannabinoids. And they are made nowadays in the lab, and they act as the plant ones, and they come in different forms, either as an oils, capsules, or dried flowers, and can be used as vaporizer, and can be a spray, and can be edible as a gummy. So what's the current evidence tell us about all this? In 2021, a randomized controlled trial found that there is small improvement in the pain compared to the placebo, and also small improvement in sleep as well. So the benefit is kind of limited to a small group of people. So from that, the potential benefit versus the harm should be considered for patients. So it should be tailored and considered patient by patient. You can't just generalize. And as we all know, the potential side effects, which can be intolerable, which is drowsiness, sedation, dizziness, impaired concentration, dry mouth, cognitive slowing, all of that is really intolerable and can be unpleasant. And not only that, we need to remember about the potential interaction with other medicine, like for instance opioid, which can also add to the drowsiness, anti-epileptic, blood thinner, immunosuppressant, and medicine used for mental illness. And we have to think also about an important concern, which is mainly the addiction, as we all know. And this can cause cannabis use disorder. And if you stop it abruptly, it will cause withdrawal symptom like irritability, sleep problem or disorder, craving, tolerance, and whereby you're going to increase the dose in order to get the same effect. So where this will leave us? It's a kind of tricky because you're not decided how you can use it, and it's not like has been portrayed that it's a medicine for pain, especially if it's chronic pain and it's not related to cancer or any of that thing. So in this condition, we need really to think thoroughly how to prescribe this. We need to let the patient know that not everyone can see any difference with that. It's only a small number of people who has been noticed to have this sense of feeling of relief. And we need to think about weighing things between the benefit and risk in order for us to decide if this is something really we need to prescribe. We need to give red flags and explanation thoroughly to the patient in order for them to decide. So let me know in the comment how you found this podcast and if you have any experience with prescribing those kind of medicine and how it went with your patient. Thank you.